To Dr. Phil's office. Today we have a regular day with a patient who you can see our fine specimen doing push-ups outside. I'm gonna go get the patient and see him in the chair. Hello?
Oh, hey.
Hey, how you doing?
Hi.
What's your name, sir?
Josh.
Josh, nice to meet you.
Nice to meet you too. Are we ready?
We're gonna have you take a seat over here and I'm gonna get Dr. Phil.
Hi Josh, how are you doing?
Hi. What's your name?
I'm Dr. Phil. How are you
Dr.
doing?
Phil, nice to meet you.
What brings you here today?
I've been feeling a lot of pain in my teeth right around here.
Okay, like how long ago was that, for how long have you been feeling that pain?
About 3 weeks now.
3 weeks? How'd that happen? Like, what started it?
I got sacked in a football game. Hit my head pretty hard. Started feeling some discomfort a little shortly after that.
So is the pain in just that one area or everywhere?
Pretty much just this area, kind of in the front here.
Okay. So the first thing we're gonna do is take a medical and dental history.
Okay.
So are there any significant is there a significant medical history I should be concerned about?
No.
Any medications?
No.
Medication, okay. So on the scale of 1 to 10, how bad is the pain? 1 being the best, 10 being the absolute worst.
It's probably about an 8. It's pretty painful.
All right, I just have a few more questions, and then we could we could come up with a diagnosis and set up a treatment plan.
Okay.
And so, is your tooth sensitive to? Is your tooth in pain when you're just relaxing, or is it when you're eating or drinking something?
It's pretty frequent throughout the day. I notice when I'm like chewing on something, like
Okay.
I like to eat a lot of ribeye, so when I'm chomping down on a steak, it seems
Okay.
pretty painful.
All right. So what we'll do now is we're gonna run some tests.
Okay, what kind of tests are you running?
So the test is one test is called the EPT test. So that test, if that's gonna test if your tooth is still alive or not, whether it's vital or non-vital.
Could be dead.
There's a possibility it could be dead, and judging by the color of the tooth, there's a good chance it might be.
Okay.
And after that EPT test, we're gonna do a cold test. So I'm literally gonna place a cotton swab on your tooth to see if you can feel the cold.
Okay.
And then the final test is it's called percussion and palpation. So I'm just gonna gently tap on your teeth to see if that's sensitive, and then I'm just gonna feel around that area to see if there's any swelling around. All right.
Pitter patter. Let's get at her.
All right. Let's get started.
I like hardly even hurt.
Oh, yeah, it wasn't too bad, right?
Yeah, not bad at all.
All right, so we finished some of the tests, the EPT test, the cold test, percussion and palpation test. So I'm gonna go discuss the results with the attending in charge, and then I'll update you with diagnosis and treatment plan. Okay? Any questions?
No, not right
All
now.
right, I'll be right back. All right, hi, Dr. Dumbledore.
Hey, Dr. Phil.
So I have a 24-year-old patient here, and his chief complaint is he's having pain on his on number 7. So no significant medical history or medications.
Okay.
So I did run some endo testing. So I did an EPT test, a cold test, palpation and percussion.
Okay.
So for the EPT test for the tooth in question, it came back as 80, so signs of it being non-vital.
Okay.
The cold test tested negative for it, wasn't feeling anything. But the control teeth adjacent to it, so number 8 and number 6,
Okay.
they came back
Within
the normal limits.
Okay.
So I also, during percussion and palpation, he was feeling sensitive. And I did take a look at the radiograph. I didn't see any periapical lesion, but I did see widening of the PDO.
Okay.
So just to backtrack, the reason he came here is because of pain when he got hit during the football match.
Okay.
So I think the diagnosis is a necrotic pulp,
Okay.
and then symptomatic apical periodontitis. So if you want to take a look at the patient, I would appreciate it.
Okay. Very good. So as we discussed the result, one more time, did we take the radiograph and did we fill out the diagnostic form?
Yes.
Okay. Okay. Hey Josh, my name is Dr. Dumbledore.
Nice to meet you.
I'm here to make sure what the student came up with the diagnosis, and I'm pretty much agreeing with him what's going on, considering the discoloration, radiographic findings, and EPT test what we did on you. It looks like we have to do root canal treatment on you too. Okay? It's going to take a little long, like you may have to come for 2 to 3 hours for your. Yeah, I'm sorry to say that, but this is
Jeez.
how the process goes. Okay.
And you can do that right now?
We cannot do it right now. You may have to come back later in.
I
Okay.
don't have a lot of free time to come back in, so
I'm
it's
really sorry. We don't have
really
free chairs.
difficult.
Okay. I know. So my student here, he's going to talk to you about everything, and I hope he must have explained you already about the root canal treatment which you may need.
What are you guys gonna do about the pain?
So for the pain, we could.
How am I supposed to eat dinner tonight?
So for the pain, if you go to your local pharmacy, whether it's like the Walgreens, you can pick up some Tylenol and Advil.
I'm taking Tylenol. That's not helping.
That's right, because you're just taking Tylenol. Just alter it with Tylenol and Advil every 3 to 4 hours.
If that's not helping,
Well, we'll try to get you in as quick as possible, and
Yeah.
I gotta
once
eat my steak. Gotta get my meals in, my macros.
We'll take you as soon as possible, and we get that infection out of your mouth, and then you will be fine. Okay. But until then, just keep taking Tylenol and Advil as needed. Okay.
Okay.
Alrighty. See you soon then. Okay.
Alright, thank you.
Alright. Phil, let me give you a swipe, and let's get started with this thing. Okay.
all right. No, thank you.
Swipe.